I'm standing in front of Swedish Edmunds Hospital. It's a private, non-profit hospital here in the greater Seattle area, operated by the Swedish Health Service, a private healthcare operator that operates multiple hospitals in the greater Seattle area. Despite the name, it is an American healthcare corporation that was founded in 1910 here in Seattle, Washington. In the United States of America, about 50% of all hospitals in the United States operate like this one. A private institution that is classified as a nonprofit, meaning that while they still make profit like a normal business, and they operate like a business, trying to maximize profit, they don't have outward shareholders or investors that need to have a say in the company and how it works as a business. However, this story changes from state to state, creating different types of hospitals that have different systems and that affect people differently, like how they make their money, how they regulate themselves. And amongst this mess, a growing voice across the pond has started to scream that their system is better than ours, the United Kingdom's healthcare system. I mean, compared to the American healthcare system, it is almost completely alien. So today I'm going to talk about the United States healthcare system and the United Kingdom's healthcare system, and talk about how the governments that have formed over time have had such a large effect on how these systems are regulated and how they work in our modern age. First, let's go over some basic vocab words that could be somewhat confusing when talking about healthcare systems. Private is a very general term that refers to the private healthcare system in general. When a healthcare system is private, all of the internal work and functions of the system are completely managed internally and are funded by themselves, making a profit, just like any other business. The only government organizations that private healthcare systems answer to are regulatory bodies that make sure the hospital systems are maintaining a standard of healthcare that is safe and effective. Nonprofit is a literal classification of an organization that's very strict and specific. A nonprofit is specifically an organization that does not take any money from shareholders or investors, rather being entirely funded by charitable donations and other forms of monetary benefit. Nonprofits can make revenue from the services they provide, but they must be funneled back into the company and its efforts instead of being used to make the owner's money. Not-for-profit can be a deceiving term. Much like a nonprofit, not-for-profits claim to not make any profit on top of the revenue they get from providing services, claiming to funnel money back into business just like traditional nonprofits. However, not-for-profits don't have any of the same legal qualities that a nonprofit does, instead operating similarly to a private company. They don't have tax exemption like a nonprofit does, and they can't have a different legal entity like a nonprofit does. Really, the only difference between a private company and a not-for-profit company is the claim that they don't make profit. And finally, public. Public is another very general term and can mean a lot of things depending on the context. However, when talking about healthcare, we generally use it in the context of a nationalized healthcare system that is funded by the government through taxpayers. Public systems don't make a profit and aren't organized like a traditional private company, nor a non-profit company, instead being managed by a separate government agency. With vocab out of the way, let's talk about how the United Kingdom's healthcare system works first, as it's somewhat simpler. The vast majority of all healthcare within the United Kingdom is provided by the NHS, the National Health Service. Since 1948, the NHS has been overwhelmingly funded by taxpayers within the UK, making it a fully publicly funded healthcare system. Outside of dentistry and optical health, the NHS fully funds all medical procedures and medication costs for any patient who needs it. This means that the vast majority of hospitals in the UK are part of the NHS, outside of a very small niche market of private healthcare providers. The NHS provides GPs, general practitioners, to hospitals to treat patients and provide referrals for specific medical needs. The entirety of the NHS is connected, even between countries within the United Kingdom, meaning that if a very specific medical need is diagnosed, any other hospital under the NHS that has the solution to said need can provide that to the person at no cost. This is anecdotal, but I visited Scotland before, and I was shocked that in a tiny village called Portree on the Isle of Skye, there was a small community hospital called the Portree Community Hospital that, since 1967, has been fully operated by Scotland's division of the NHS. This means that if I visited this hospital with an injury, I could be seen by a fully trained general practitioner and get diagnosed with whatever ailment I have, and then be fully available to the entirety of the NHS system if what I needed was outside of the scale of the small community hospital in the middle of nowhere. The American equivalent to this is essentially living in a small village in the middle of Alaska, visiting my local doctor's office and having the full scale of the entire American healthcare system to help myself heal, all without a charge. The United States healthcare system is vastly different. The United States doesn't have a fully publicly funded system like the United Kingdom does, rather letting all hospitals in the USA to choose to work with insurance companies to provide healthcare to the population. Insurance, especially health insurance, is tied to employment in the USA, meaning that your employer provides you with a specific healthcare plan and a list of hospitals that work in your network. These hospitals perform just like hospitals in the UK, with general practitioners providing diagnosis and basic treatment, and referrals to other hospitals for needs that can't be addressed on-site. However, where things start to differ is how to pay for this healthcare. Each individual insurance plan in the USA denotes what it does and doesn't support, So after your treatment is completed, the hospital goes back and forth with your insurance company to provide you an itemized bill. These bills are generally partially subsidized by your insurance company, with the rest of the bill being laid to the consumer with the expectation of payment. Virtually all hospitals in the United States work like this, including not-profit and not-for-profit organizations. Different states have different ratios between the different types of hospitals, but because the vast majority work in this way, the ending result is generally the same. If you go to the hospital, even with insurance, you will have a bill waiting for you. How did this come to be? The United Kingdom created the NHS following World War II, where the UK's social welfare system was in shambles due to the war effort and destruction across England. This rebuilding of social services opened up opportunities for the UK to implement a larger public health system than what was previously possible. Thus, the National Health Service Act of 1946 was born, and aimed to create a large network of contracted practitioners to create a public health system that could serve as many people as possible. In the following decades, the system grew into what it is today, following various setbacks due to attempts to improve the efficiency of the service. The United States system, on the other hand, grew naturally out of the free market economy that followed the post-war economic boom in the United States. Insurance companies, at the same time, grew to be very powerful political lobbyists that could influence how attempts at public healthcare systems were implemented in the U.S. Having a private system turned out to be much more profitable for both private hospitals and insurance companies, leading to heavy pushes to keep the system private during the mid-20th century. Because of how the system has grown, it has very much planted its roots in its place and won't be leaving anytime soon. So attempts at healthcare reform have been attempted in the U.S. and have had varying results. Most notable was Medicaid/Medicare back in the 1960s, which provided health insurance to a larger margin of the population, and the ACA/Obamacare in 2012, which expanded this even further. More recent attempts include the No Surprises Act, a federal act that now prohibits surprise bills from out-of-network providers in the U.S. All of these attempts of healthcare reform are to try and make healthcare a more available practice to the general population. But this is always done through health insurance, not through the actual root cause of the problem, which is how private and not-for-profit and non-profit hospitals work in the USA. So there you have it. Those are the major differences between the two country systems and how they came to be based on the country's history. There are positives and negatives for both sides that I didn't discuss, but really the point of this was to create a visual that helps people understand the key differences between the two systems, or how they play a role that almost foils each other. Thank you for listening.